My name's Denise and I'm doing the introduction and the final conclusion of today. Welcome to the 6th Masterclass in the series of person-centred practice and research. Masterclass number 6, it's gone very fast, but just a bit of a reminder of what we've had in those last year and a bit. We had Val, who introduced person-centredness to us. We've had Kim Manley, we've had Karen Takiri talking about quality and safety. Then we had a number of PhD students keeping person-centredness at the centre of your research. Then we had the lovely Beck Middleton, who did a beautiful talk on person-centred leadership. And today we have Greta, and I'm going to ask Maria in a minute to introduce her. But we are, is it videoing, Susie, or is it just recording voice? Yes, so just so you know, you are being recorded, and this will go up to the SESLHD YouTube channel when Susie has some time and has a look at it and checks everything out. Before we start today, I want to do an acknowledgement of country. I'm actually in a different bit of Sydney today, so that was such a beautiful experience coming along the south coast on the train through Sydney over the Harbour Bridge and coming to North Sydney. So I want to acknowledge the traditional custodians of the land in which we meet today. And for me, this is the Gamaragal, is that how you say it? Gamaragal. People, we honour the ancestors of yesterday, the custodians of today and those of tomorrow. We recognise the continuing connection to land and waters and how culture is held, nurtured and shared, and we pay our respects. And we've saw some beautiful welcome to countries recently, and not being tokenistic about that is actually to take a minute to reflect on the land that we're all about to learn on today with a great talk from Greta. I'm sure it will be absolutely fabulous. So what we're going to ask you to do, if you've got questions as Greta talks, you can pop them in the chat box and Susie and I will try and moderate them. But I'm now going to hand you over to Maria Flynn, who's the new Director of Nursing and Midwifery, Executive Director of Illawarra Shoalhaven Local Health District. So are you there, Maria? And you'll introduce Greta.
Yeah, thank you, Denise. So I'm Maria Flynn. I'm the Executive Director of Nursing, Midwifery and Clinical Governance at the Illawarra Shoalhaven Local Health District. I moved here in August this year from the Royal Children's Hospital at Melbourne, and in 2018 I moved from the UK to Australia. It was my lifelong dream to come here, and I came to see the world, and I got locked down in Melbourne for about 300 days. So it's been a bit of a whirlwind, but I'm now in the beautiful part of the world here. So also acknowledging and paying my respects. But I don't want to speak for long because Greta and I have been colleagues and friends for a number of years, and hugely proud to call Greta a colleague and a friend who moved to the Chief Operating Officer role for the Florence Nightingale Foundation in London and is now the Chief Executive. So I would like to hand over to Greta because it is wonderful to have her here. And would use her skills, and she'll introduce herself and the concepts of the Florence Nightingale Foundation, and hopefully this is the first of many partnerships across the world to be able to do that work. So Greta, I'll introduce you. Thank you.
Oh, thank you, Maria. I've taken myself off mute. Yes, marvellous. That's the first lesson. I always put myself on mute, and then I forgot to take it off. So great. Thank you so much, Maria. It's wonderful to see you, and hopefully I'll catch up with you at the end of the week. So many people on this call. It says 80 people. That's incredible, and I believe across the whole health district. So it's wonderful to see you. Now, the reason I'm in Australia and nearly wasn't on this call is because I'm spending 2 weeks in Australia. I've spent 1 week already in Australia visiting CNMOs in New South Wales, ACT and Melbourne, and a number of chief nursing officers in those organisations. And I was due to come back from Melbourne yesterday. However, this hideous thunderstorm, which no doubt you probably heard and saw, meant that my flight was delayed and then eventually cancelled, like last thing at night. So I had to stay the night, and then they put me on a 16:30 plane this morning, and I thought, well, I'm either going to be at the airport or I'll miss this call entirely. So I did manage by hook or by crook to get on an earlier flight and pleaded the fact that I had this really important meeting to come back to. I don't know whether that worked, but something worked. So I've got here. But wonderful to see you all, and it is an absolute delight to be in Australia. Maria will know that when she was the CNO for the Children's Hospital in Melbourne, I had planned to come in 2019. Obviously, was it 2019 or 20? I can't remember. 20 probably. Anyway, that was going to be a plan, but the world has changed since then. But it is wonderful after all these years to eventually do this trip, not only to see my daughter who lives in Sydney, not a nurse, but also to spend the time really trying to understand a little bit about how Australian nursing works, midwifery works, and try and spend a little time with CNMOs and chief nursing officers or chief nurses to explain the merits of the Florence Nightingale Foundation. So if you don't mind, I'll indulge myself a bit in that later on. But principally, I think I'm going to do a summary. This is the plan of person-centered care. Some of the why we do this and the evidence around it. So thank you for that introduction beforehand. It sounds like I've pitched this right. This is your last session. So all of those 18 months ago, if you kind of forgotten around the evidence, maybe I've picked up on some of the new stuff that has been published since. So I'll share my screen and let's see if this works. Oh, that's the chat. That's not a good thing. Hang on. Can you all see that? Is that working? Yeah.
Yeah.
Wonderful.
Yep.
Let's put it on slideshow. So here we are. Right, brilliant. Thank you. And as Maria said, I'm the Chief Executive of the Florence Nightingale Foundation. So some of the things that I wanted to talk about this afternoon is really to summarise, I guess, where the world of nursing and midwifery is around person-centred care, highlight some of the recent evidence base. Now, you may have heard of this already, but some of it might be, and this is, I mean, literally a whistle-stop tour. I'm not going into the whole literature around person-centred care. I've picked out some person-centred care resources, and then, as I said, I wanted to indulge, if you wouldn't mind me indulging myself in letting you know the activities of the Florence Nightingale Foundation, who we are, why we are a charity in the UK, and then finally to hopefully describe some opportunities that might be available for you as senior nurses in this part of New South Wales. So that's kind of the last bullet point, is really some of the things that I've been speaking with around the States as I've gone on. So person-centred care. So if you don't mind, I'll refer to it as PCC, this is, I'll just get rid of that picture. That's better. So PCC, and obviously over time this has changed from patient-centred care to person-centred care, and this distinction really is that person-centred care refrains from reducing the person to their symptoms or their disease. And how many times do we hear that still? And I wonder how many times that we can check ourselves to make sure that we do always put the person in front and centre of the care that we give. And so person-centred care is really about the notion of the person, which calls for a more holistic approach to care and takes into account various dimensions of the whole well-being, particularly around the person's preferences and beliefs. And in addition, not only considers the person, the patient, but also the people, their surroundings, their communities, their relatives who are part of their caregiving. So it's not just about living with an illness, but it's how we make sure as nurses and midwives, by considering the person always at the centre and not the patient, we, as well as the managing the sick and the illness, we are thinking about prevention and promotion. So I guess my next slide is really about why we do this. Now, there's been, and I'm sure that you know, all the statewide policies around emphasising the value of patients' views. And that's really not only in the way that we design care, but we design care they co-design the care with us. So it's about considering the unique information that how healthcare is effective, and it includes the patient's experiences and outcomes. And of course, that plays a big part in increasing patient satisfaction, but importantly, plays the thing that we really want to do in this situation is make sure that we're improving patient outcomes, health outcomes. And so here we are in 2020, we do need to address the increasing healthcare costs. And as many of the healthcare systems around the world are thinking about this, I think it's more clear, and it is becoming more of a universal model to think about person-centered care model. And at the global level, the WHO has developed policy frameworks to support people-centered healthcare, and highlighting the person in the centre and making sure that there's a core competency for health workers. And this plays a key component of the healthcare and quality that we give. So I put this here, the reference for this is at the bottom of the slide, but I think this is, for me, as a brilliant summary of why we should, as nurses and midwives, make sure that we consider the person or the people-centered healthcare. So what WHO say that it's rooted in universally held values and beliefs, and which are enshrined in international law, such as human rights and dignity, non-discrimination, participation and empowerment, access and equity, and partnerships of equals. So I guess when we think about the care that we give, do we always think that we consider all of these principles? Do we hold these values true and dear to us? And do we make certain that in so doing, that the patient is front and centre of the care? So the WHO say that the aims of person-centred care is to achieve better outcomes, not just only for the people, the patients, their families, the communities, the health practitioners, but the organisations and the health systems. And we can do this by promoting three things: the culture of care and communication, responsible, responsive and accountable services and institutions, and supportive healthcare environments. So the culture and care of communication is that we make sure that we involve all of the people that we look after in their decision making, and make sure that they are part of that decision making, and that they have choices. Of course, respecting their privacy and dignity, and responding to them as a holistic person, rather than, I said before, the disease or the condition of which they have come to healthcare with. And our services should be responsive and accountable, so providing affordable, accessible, safe, ethical, effective and evidence-based care, and supportive healthcare environments. So making sure that our organisations, those that manage our organisations, are putting in place appropriate policies and interventions to make sure that all of our stakeholders have a say in the health services that enable them to be part of the community in which they live, and also providing some feedback about quality improvement. This doesn't seem to move. Wait a minute, what's going on? Oh, no, it has moved twice. There we are. So when I was thinking about speaking with you today, I just did a quick dive into what is the most recent evidence base around person-centered care. And I found it's always good to find for those of you who are researchers in the room, it's always good to find a really great systematic review. And I found this one published in 2020 by some Swedish colleagues, and it describes the components, the essential components of implementing person-centered care in an out-of-hospital context for older people, so those aged 65 plus. And so what they did, they identified 65 articles, and from that they synthesized some 4 interrelated themes. And this is really, I think, is really picking up what I've said in the previous slides, is that in order to be truly engaged in person-centered care, it is critical that when we implement person-centered care, that we always know and confirm that the patient is as a person, as a whole person, that we co-create a tailored personal health plan, that there's interprofessional teamwork and collaboration with and for the older person with his or her relatives, and that we build a person-centered foundation so that everybody comes together to provide this personal health care. The person, the patient, the person, the relatives, the communities are at the centre of this. And if we do this, the conclusion of this literature review was that we would certainly place a greater emphasis on preventing and promoting healthy actions, which would be critical to co-create the best healthcare that we can. Then I thought, well, I wonder what the Australian government does about this. And I found on this particular website a whole resource around person-centered care. And I know that you'll know this because I'm sure you go to it every day. But I wondered whether this was a point of conversation this morning or this afternoon. We're this afternoon, aren't we? Sorry. So the Australian Commission of Safety and Quality in Healthcare has, this is one of their tabs, person-centered care. And if we do this, we now know that this is the foundation to safe and high quality care, and that we respect the individuals with whom we look after, particularly around their needs and their values of the patients and the consumers of healthcare. So I wanted the next slide. So I picked out screenshotted one of those, the next tabs, which is about how do we implement person-centered care. And the screenshot includes promoting, supporting person-centered care with healthcare professionals, evaluating person-centered care in healthcare organisations, staff wellbeing and teamwork as part of person-centered care, and patient safety as part of the person-centered care. So just looking at those 4 things, I wondered whether there's a conversation to have, and you might want to put this in the chat, but I wondered whether we could be truthful about how are we doing, or how are you doing in this respect? Are we always paying attention to those things? Is there more that we can do? What do we do particularly well? And what could we do even better? And I always think that if we could think about the future, like what would success look like in the next year? What would that look like? And I don't know whether it would be relevant just to stop right now and put the pictures of you all up, just to whether there's a conversation around that, whether you don't want to do that, Maria, or shall I move on?
No, I think that would be great. I mean, I was just typing in as a bit of a starter is, I think there are still silos, and I'm working on a particular piece of project around falls, for instance, and falls management is still very much siloed with what we can provide as acute services and what services are in the community. And if we were really truly person-centered, I think the systems and structures we work in would allow us to be able to, for instance, engage with eye checks, help people from a social care point of view, purchase new footwear. And it would be really interesting, Greta, because I know you've been sort of traveling the world, and whether you've come across a structure which facilitates person-centered care more, because I think the Australian structure is very similar to the UK structure in as much as primary care and healthcare, but of course we have more complexities here with the GP billing, and not even, you know, and it's not even free at the point of care. So just that would be good for some reflections if you've come across systems where they've broken those barriers down, and what might we be able to do with those barriers in place.
Well, I think, Maria, that both countries should pat ourselves on the back about this. I think that whilst we do think that we could do better, and that is definitely, and we can always do better, there's always some better system of care that we can give. I think when you compare, I mean, I've been to a few countries, but when you compare it to, I've recently come back from Texas, and I would say, if any of you are from the US in this room today, I would say that we stand head and shoulders above the US in terms of their nursing and midwifery care, and how they put the person in the centre if they do, because theirs is so medically dominated, and it's the medical model that ensues, and of course it ensues because of the billing structure. And so the bill, seems to me, is the centre of the care that the US, particularly in Texas, seem to provide. I think our Nordic partners do this perhaps a bit better than we do, and certainly that paper about older persons care, that systematic review from Sweden, I think if we look to our Nordic colleagues, we would find that they do this better than, maybe a bit better than us. But I think considering where we are in the NHS, and considering where you are in Australia, I seriously think that there is still much that we can do. And I was really pleasantly surprised when I saw on your on that government webpage about person-centred care and the resources that are available to you. We haven't got any of that. I think we are behind in, I think we can talk the speak about person-centred care, and we do that probably erratically across the UK, but it isn't, definitely not a system-wide attempt at delivering healthcare. And so I wondered, therefore, is it a kind of a scattergun effect right now in New South Wales, or is there a process where you want to get to, that you're aiming for, and perhaps this series of webinars is part of the process for enlightening the staff about the importance of person-centred care?
Val, you've got your hand up.
Yeah, Val.
Yeah, well, I was going to say, I think we find pockets of it where it's systematic, more systematic. I don't think any one healthcare organisation that I've dealt with has got it all sussed, but there are certainly some that are moving towards that by being systematic in the way, for example, one of the things was about evaluating care, and how you actually collect data that tells you about person-centeredness, not just about the things that we're always measuring. So I think we're certainly making attempts to do that, and we're working with the Chief Nurses of New South Wales and South Australia, in collaboration with our colleagues in Northern Ireland and the rest of the UK, in trying to come up with ways that which we can access information from our consumers that tell us something about how person-centred we are in the delivery of care, that will add to the traditional metrics that we already collect, which is usually about things we don't do well in care. So that's just my little plug. So I think we are moving forward. Could we do it better? Of course we could. We need to have more focus on person-centeredness. I think what happens is we get a focus on it, and then another shiny bauble comes along and people are off looking at something else. So we need to be systematic and rigorous and look at it not as just a short-term goal, but a long-term goal with lots of little, I suppose, successes along the way.
Yeah, so I think you've said that there is there's variability about how that's delivered in New South Wales, or your part of New South Wales, should I say, and is the aspiration that you would like it to be a more systematic approach, and therefore a bit of a mandate about this is how nursing and midwifery care should be delivered?
I think Barb's got a comment.
Yeah, so I think you know, I definitely agree with what Val has said, and I think it's interesting because I think it has to start in our strategies. And I think what we've seen from the ministry is, you know, with the particularly from the workforce branch, you know, we've got a framework called Elevating the Human Experience. And coming from southeastern Sydney with our their strategic plan, there is actually person-centeredness in their plan. So I think once we start talking about it and it becomes a language, I think we'll then, you know, I'm seeing it higher up, but then how it cascades down to the, you know, to LHDs, but also to the individual facilities. I think, you know, we've now got a language, and I think it's about how we bring that language into the undergraduate space, but also how we as, you know, senior nurses and midwives are able to articulate and really create that inspired vision of being truly person-centered. So I think it's happening, but it's happening in pockets, but I think there's a hunger out there for it.
Amazing. That's fantastic. So if you think about what it looks like, what success looks like in a year's time, is that that's two in the future? I mean, is 1 year, 2 years, is that a better metric? And I think I concur with now then I've lost you on the screen. Here we are, Val. I concur with Val about let's try and measure this in different ways. Let's not measure it from just a patient satisfaction level. Let's measure it from a true framework that we can all use that's generalizable, and it picks out where true person-centered care is being delivered and the difference it's making to health outcomes. And so I think that, I mean, I guess there are frameworks that we can pick out and start to restructure to make it more applicable to. I mean, there was one I found for 2007, but I thought, well, that's probably preceded, being succeeded by different framework now. But it's amazing that you're working with Northern Ireland and the rest of the UK to try and find a generic framework that you can all use. In the foundation, we have scholars, and probably about 25% of them are very senior nurses, and throughout their scholarship year they have to do a improvement project. And over the last 2 years, I've started to make certain that we're all in the foundation. I think the scholars are all very good at saying what difference the scholarship has made to them as an individual. But I keep saying, okay, what about the patient? What outcomes have you measured around patient care? You know, if it was a system-wide structure they put in place, how are you measuring? How have you identified and put the patient at the center of that, or the person at the center of that? So I think as the founder, certainly in the UK, we can start to make certain that our senior nurses do take notice of that and start to implement that in their organizations. But I guess in this, there's a vision, in your case, Maria, across this part of New South Wales, or in my case, England or the UK, it's going to be a bit of a scattergun approach, I think. But like all of these things, I think where there's a willingness and where people do see that it's definitely making a difference to a patient care and the care that's given to the women, from midwives looking after them, or the service users from mental health patients, where we see that as a big difference, that we do we go on a pathway where we galvanize that amount of interest. So it almost needs a champion network to get it going and not let it drop. So if your part of New South Wales is that, then I'm sure we could match that and maybe even create a network across, unless that's Val, what you've already done in Northern Ireland and the rest of the UK, but certainly within your group, Maria, we could create a network of a person-centered network that could reach across to other parts where we know that it works well, and pick up from where there's good models of that across the UK.
Yeah, I think that would be great. I think, you know, we've all got a shared purpose. And actually, I think the really good thing about the Elevating the Human Experience, if you haven't had a chance to read it, Greta, is really a fantastic piece of work, because it talks about the elevating the human experience, not only for the patient, but also the staff. Yeah. And I think all of the evidence suggests, you know, staff who feel that they can work to the very best of their ability and within a safe and innovative and supportive environment give much better care. And I think that document comes together nicely. And in fact, there's lots of debates about where the well-being for staff sit, and lots of people are saying to me, well, you know, it'd be great if it was sat with the clinical team, so myself, the medical director, the allied health lead, and then others say it sits in HR. I think there's a place for both, but I think you know, making sure that the staff feel they're able to work to that is really the best. Now I'm just aware of the time.
Yes. 10 minutes to talk about the fact.
Yeah, so it would be great to hear. I don't know whether people really know what the Florence Nightingale Foundation is, and obviously it's sort of the official Florence Nightingale area, and it'd be great to see maybe what we could do across the world to partner maybe with the foundation.
Amazing, thank you. I was just looking at my clock, Maria, so great timing. So a little bit about, maybe not all of you are that keen on Florence as I am, so I love a bit of nursing history. In fact, one of your colleagues gave me an Australian historical book on Australian nurses just the other day, so I haven't read it yet. But for the time being, my most of my interest, because of my job, rests with Florence Nightingale. And let's go. So this slide just is a reminder of the work that she did, and of course, well, I guess we're her legacy. We've continued to do what she did, and when she went to the Crimea, all of her infection prevention and control measures, her design of hospitals. This is a picture of St Thomas's Hospital in London. Her use of data, and how, as nurse leaders, we've kind of embraced that because we've had to. I guess if you're in organisations where you've got electronic patient record, you've got the most ginormous data set there that you can use to look at patient outcomes and how we can improve care with technology. And of course, her book, Notes on Nursing, really wasn't about how a notebook for nurses, but really a notebook for people in the home to make sure that they had adequate information about how to look after their relatives when they became sick in the home. And you'll see this down here, these tall high ceilings are the Secretary barracks in Istanbul, or across the river from Istanbul, and all the soldiers, obviously because of their conditions, because of the non-ventilation of this particular area, she identified this through the Coxcomb chart, that the people in the pink area of this data set were those that were dying of their injuries, whereas the rest in sort of the bluey type areas were dying of infectious diseases. So I think as nurses, and if we're not researchers, we are using data every single day. And she obviously was a massive fan of data, and was then admitted as the first woman statistician to the Royal Statistical Society. So that was just a reflection of the work that she did, and she continued to do after she came back from the Crimea. And when she died in 1910, the International Community of Nurses and Midwives, through the International Council of Nurses, decided that there should be some living memorial to Florence Nightingale. So the first president is Bedford Fenwick, and she proposed that there was this living memorial. There was a First World War that got in the way, and eventually in 1929 the proposal was picked up and agreed by the Grand Council that there should be each of the member organisations could go off and choose how they were going to celebrate her life and make sure that nurses carried on the legacy that she had left behind. So in 1934 the Florence Nightingale Memorial Committee of Great Britain was set up, and then eventually we changed the name in 1994 to the Florence Nightingale Foundation. She was buried in this tiny church in a little village in Hampshire in the south of England, where with the rest of her family. And this is the document from the American Journal of Nursing declaring Ethel's declaration at the ICN that a living memorial was to be set up. So we've existed since 1934, a few iterations, let me tell you, but our sole purpose is to provide educational opportunities for nurses and midwives, and particularly now through leadership development. And I rather like this because there is actually an audio recording of this left that says, "When I'm no longer even a memory, just my name, I hope my voice may perpetuate the great work of my life." And so that's really why the foundation exists. We haven't let the memory of her work subside. We carry on doing that through the work that we do. So we've been providing scholarships since 1935, since 2018, leadership programs, mostly for early career nurses and midwives, but that depends on our commissioner. We can be commissioned for any level of a leadership program. And in 2020, we set up the Florence Nightingale Foundation Academy, and shortly afterwards, the membership of the F&F Academy. And I'll explain some of those things in a sec. So I guess my job as a chief exec is to make sure the foundation stays relevant and current. I've always got an ear to the ground about how do we need to develop nurses for the future. So 3 years ago, had a program, and we've had 3 cohorts of digital nurse leadership scholars. This year, which I'll tell you a little bit more about in a moment, we've launched Global Health Leadership Scholars, and those are for international nurses working anywhere in the world. And lastly, sustainable health. We all know the state of the planet right now, and I think as nurses we've got a leadership role to make sure that we're not only saving the planet in a way that's sustainable, but actually that we're doing that through the healthcare that we deliver. And our trustees approved a 5-year strategy just this summer, and we've called it Improving and Saving Lives, 1 million nurse and midwife leaders. And that just means to say that what we do is support and develop nurses and midwives to improve care and save lives across the world. And in 5 years, we want to get to our reach to get to 1 million nurses and midwives. So hence a little bit why I'm in Australia, because I really tested the water to find out if our opportunities in the UK would be relevant to nurses and midwives across the world. And I guess I've started a little bit in where the interest is, first of all, because that seems to be low-hanging fruit, and particularly in the Commonwealth, because I know that there would be a joint purpose between the Commonwealth and the UK governments to make sure that we support nurses and midwives who work across the Commonwealth. So 5 strategic priorities: supporting leadership development, influencing policy, promoting evidence-based practice, growing our membership academy, and then lastly, making sure that we have a sustainable future, not just through financial, but also social, cultural, environmental, and we make sure that we do all of that is through everything that we do. And this is kind of the vision, really. The most of our reach will be through academy membership, and I'll tell you a bit about that second. We've got some online learning development opportunities. We have our leadership programs, and at the top of the pyramid is the scholars. In the UK, we have between 75 and 80 a year, but as we go on, we want to start seeing if those opportunities, we can spread those opportunities across our global partners. And I guess what I wanted to say here is, what are the benefits of the foundation? What would be of interest? And for those of you who are sitting under Maria, and then those sitting under those that sit under Maria, our membership is available to the most senior nurses and midwives of organisations, and the senior nurse joins on behalf of everybody in the organisation. And our opportunities, our benefits, are leadership development opportunities. This year we've just introduced where the senior nurse can nominate a rising star as a fellow of the FNF Academy. And every year that the senior nurses or the chief nurse is a member, they can nominate another nurse each year, and eventually would be part of a global network of FNF Academy fellows. The other thing is, every year we celebrate the Florence Nightingale at our Westminster Abbey service in London. I'll tell you about that in a sec. And I can leave these slides with you, but really to say there are lots of benefits. This is our service at Westminster Abbey, and we hold this on around the 12th of May every year. It's quite remarkable. All our scholars attend, and the Abbey is filled with 2,500 people. And for those of you who are royal watchers, you'll know that that's unfortunately where the Queen had a funeral service, and where the King will be crowned on the 6th of May next year. Now, the 6th of May and the 12th of May are quite close, and we were due to have it on the 12th of May, but I've just been informed by the Abbey we're going to have to slip the date. But as a member of the Academy, that member would have the option of having 2 VIP tickets to Westminster Abbey. Albeit that you're many miles away, we also stream the service, so everybody will get an opportunity to see the service. And we use the lamp here as a symbol of passing on knowledge from one generation of nurses to the next generation. And this is a 1965 picture with Princess Alexandra here as our royal patron, where the lamp is passed on to student nurses as that symbol of passing on new knowledge. I mentioned we have launched global leadership scholarships this year. It's open until the 6th of January, and we're very happy to accept any applications from nurses or midwives from anywhere. And let's say your area, New South Wales, or this part of New South Wales, where you would join our UK scholars, and you have one-to-one coaching, mentorship. You come together for 5 days in London. And that's a residential. Everything is paid for, of course. Throughout that year, you have to do an improvement project, and that I would hope would be something around person-centered care. And the rest of the budget that's not spent as part of this programme is available to spend on perhaps going to a different country to look at an area of clinical excellence, where you want to bring that back to your particular clinical service area, or spend some money on your own personal development. I'll skip that one. I might just skip that one too, because we're out of time. And I want to finish on this one really to say that Florence said to her probationers when she came back every year to see those at the Florence Nightingale School of Nursing at St Thomas's, for those of us who nurse, our nursing is a thing, which in it we are making progress every year, every month, every week. Take my word for it, we are going back. The more we experience, the more we gain, the more progress we make. So I'm going to end on that one. I want to thank you for listening. I think that I've given you a little bit of the taster about what the foundation is hoping to offer. And if that's of any interest to you as senior nurses about joining as members, I've just come back from Melbourne, and the Peter Mac Cancer Centre have joined as the Royal Melbourne Hospital. And I think, Maria, you'd be pleased to know the Children's Hospital and eventually the Women's Hospital. So we've got there'll be a collection of hopefully a network of Australian chief nurses joining the Academy as members. But we don't know where it's going. If this is of interest, if you think that the foundation could offer you as nurses and midwives in New South Wales some opportunities for leadership development, to be part of a eventually a global network of senior nurse leaders. And importantly, I think, is to recognise rising stars in your organisations that you can put on a platform that will begin part of their leadership development and enhance their leadership development. Really, I would be really delighted to hear from you. So Maria, shall I leave it there? Because I'm sure you all got to go off and
yeah, thanks. Thank you. I think it's really exciting. This is really just us spreading hands across the world. We've all had a really difficult period of time. You know, 2020 wasn't the year of the nurse that we anticipated it was going to be, and certainly from a nursing and midwifery perspective. And I know you've been meeting with World Health teams and influencing sort of policy. So I think how we link together and how we really spread the word is really important for us all. So it's great to have your time here. For those in my team, you're coming back on Thursday, so we can talk a little bit more about what we can do for ISHLHD specifically. But thank you for your time. I know it's been a whirlwind stop for you.
Yeah.
And I'll hand over to Denise to close.
Yeah, thank you very much, Greta. That was really interesting. I'm sure we'll all find out from Maria and others more about the foundation. We didn't really have any questions, but there was some words in the chat box, and there was words like we have to be more proactive rather than reactive, about true partnerships with our patients around consumer engagement, and also measuring what matters. And there was something there about if we knew these kind of measurements, it might help nurses and midwives be more engaged and take more pride in the work that they're doing. So we can certainly see that person-centred care, person-centred cultures are something that most of the nurses on here are actually on this masterclass because they really care about this stuff. So we've left an evaluation up there. We haven't got a date for 2023, but we'd also like you to write in the chat if you have anybody that you would like to do a presentation, any kind of particular topic that you want, and we will try and accommodate that in the new year. But watch out for masterclass number 7, and the evaluation is up there if you wouldn't mind. That would be really helpful for us in our planning for next year. Susie, was there anything else?
No, yeah, I think you've said it all, Denise, and I'd just say thank you so much, Greta. That was so lovely to have you and hear about the Florence Nightingale Foundation and over in the UK. Yeah.
Well, I'm looking forward to chatting with the team again. So maybe we can have a deeper dive into it. But
yes.
Really, thank you for listening to all of you. I wish you the best rest of the day. And hopefully I'll get to see, I know I'll be back, as they say, but I think as Maria said, this is hopefully the beginning of a very, very fruitful partnership with bits, not every bit, but bits of Australia, and certainly Melbourne were really receptive. So I know Maria likes a little bit of competition.
Enjoy the rest of your time in Australia, Greta.
Thank you so much. Bye bye.